How can I effectively communicate regarding shade to the technician?
Right. Effective communication requires photographs, and you can take very simple photographs with a smartphone and, try and give the technician an idea as to what kind of shade is required for the case. Getting the shade right it's not a very easy thing, especially if it's a single central incisor. But I always prefer that the clinician takes the shade and then communicates it and then discusses it with the technician.
So I've read this, we cannot convey the 100% accurate shade even if we photograph it. So can we standardize it during communication?
Standardization is possible to an extent. We've got something called a gray card. Okay, it's a white balance reference card which we can use for shade communication. I generally, I use that for shade selection and then communicate that to the technician with photographs. So it's a white balance reference card that's used for color correction. So I use it personally for shade selection myself, and definitely those photographs will be shared to the technician for doing the case.
So how exactly a gray card functions?
Yeah. So
can I use it in my clinic as well?
Yes, you can use it in your clinic. So ideally, to take excellent outcomes, you need a DSLR camera to get in. That's why for many for documentation purposes, it's always advised to use a DSLR camera. But using a gray card and a simple smartphone will do the trick for shade selection. And also to get as much as details regarding the case, for example, what kind of characterization is required and some areas of hypoplasia that you want to record. So you can do that with the help of photographs with the gray card.
So I commonly use Vita Classic in my practice. Do you think Vita Classic is different from 3D Master, or do you have any recommendation that it's better?
Well, both are great shade types. Obviously, the Vita Classic came out in 1956 and the Vita 3D Master came out in 1998. Now the concept of shades is moving on into, as I told you, color values, right? LEB values to identify color accurately. But regarding shade types, the Vita Classic is, has got 16 shades, right? The 3D Master has got 26 shades, and the Bleach Guide has got 29 shades. So basically, the Classic has, is not focused on value, and we know that value is the most important aspect of shade selection, right? So Vita Classic has 4 groups of shades: A, B, C, D: reddish brown, reddish yellow, gray, and reddish gray. Whereas the Vita 3D Master is arranged as in the form of values like 1, 2, 3, 4, and 5. So definitely Vita 3D Master is a more advanced version of the classical and helps in shade selection better. You get a wide range of shades to select from, because with classical there are many times where you face a situation where you're not getting any of the shade from Vita Classic. So 3D Master definitely helps in shade selection and has got a wider range of shades.
How can I use this effectively in my practice?
Well, it's quite very simple. So first you select which value range your shade belongs to. So you can either take, for example, now the basic kind of match that would come. So you can take the middle of each value, like you can take 2M2 and 3M2 and see which value matches first, right? And so you check values by, you can take photographs to check the value and set the photo to a monochrome, and you can actually see whether the shade matches. So once you select the value, then you go to the chroma and the hue. So that's how we do it.
So can we see how it's done?
Sure, why not? Let's do it. So the first thing is lighting. Make sure that your area is adequately lit. Then retraction. Retraction is a very important part of shade selection. We don't want any shadows that are falling on to the teeth while we're going to do a shade selection, and the patient themselves can do the retraction and just, replace it like that. Wonderful. Okay, so we're going to use the 3D Master from Vita. It's the two-guide 3D Master for the shade selection. The first thing is to select the value. All right, we've got the value groups as 1, 2, 3, 4, and 5, right? So, looking at her, okay, we're going to do the 2, 1, okay, the central incisor. So we're going to select 1M2 and 2M2 in order to decide the value, right? So let's do it. Most important thing is we need to open the mouth. Yeah. And the shade depths need to be in the same plane as that of the tooth. Okay, we can't keep it in front or behind. We need to keep it as close to the tooth as possible and in the same plane as the tooth. And next, if you're taking a photograph, we need to place a gray card too. So you can keep both these shade tabs, okay, to get an idea as to which one matches better, or you can do it separately.
Hope you guys enjoyed this video and stay tuned for more valuable tips and tricks to enhance your dental practice. Don't forget to check out the description link below to shop the gray card and the shade guide mentioned in this video. Subscribe for more insightful content and see you in the next video.